Okay, sounds great. So good morning. My name is Roupen. So let me share my screen and let's start this. Alrighty, I will advanced, share portion of the screen, share, and then I'm gonna talk to you about the interview process today and why it is important. Okay, so let me tell you about myself first. Can you see, everyone, can you see my screen? Let me open the chat here.
Yes.
Awesome, amazing. Okay, so my name is Roupen. I'm an internal medicine resident in Canada, Ottawa. I started residency in 2019. I came to Ottawa, Canada in 2017, and I was able to match from the first time. But 5 years ago, when I arrived, I remember very well, like it was 2017. I knew no one in the system. And at the same time, I wrote the American exams. So if we have any participant here applying to the US, welcome, this applies to you as well. So I was doing the US exams and I was doing the Canadian exams at the same time. I wanted to match in Canada. The only thing I was told 5 years ago is go to the US, go to the US, go to the US. You don't have any chance to stay here in Canada. And I was like, okay, let's give it a try. Like, why it's so difficult to get into the system? Like, what people talk, what are people talking about? Like, you can't tell me it's a difficult without giving me a why reason. People quote, oh, like the acceptance rate is 23% or 30% if you take into account the second match. I was like, oh, no, let's give it a try. So I gave it a try, I got in the system and I was like, okay, it's doable. And then when I was in the system, I was like, I wanted to be on the other side of the table. So I joined and helped the program, and I learned more about like what are they looking for when it comes to international medical graduate, because like, it's important for me. Canada, it's a great place. It's a great place to practice medicine, and there is a need for physicians. So I made it one of my purposes in life to understand why it's hard to get, or how to get into the Canadian medical system, and what are they looking for. So over the last 4 years, I've interviewed many applicants who successfully matched into the Canadian residency through the Canadian Residency Match Service. Some of them are young, some of them are old, some of them tried once, and some of them tried several times, 4 or 5 times. Some of them applied to internal medicine, some of them applied to public health, some of them applied to even general surgery. So I took it on myself to interview people and find them and share their experience. So if you know anyone who matched and they are willing to share their experience, please send them my way. I would love to interview them. It's important, eye-opener for everyone. But also at the same time, I was helping many international medical graduates, whether in Canada or the US, to ace their interview process, because like I believe I believed actually until recently, I proved it. I will show you a research I did with my colleagues on this. So I believe interview is one of the most important things when it is one of the most important things, right? I'm not saying it is the most important, it's one of the most. So there are other factors, and that's what brings me here today, is to give you a brief idea about how to approach the interview. I made an interview preparation course. It's online. Whoever wants to get a view, I sent the link through the email yesterday. I have a CV course, and I help people with their interviews every year, whether they are applying in Canada or in the US. Okay, so my goal for today is to help you prepare for your interviews and prepare for CaRMS, and make the interview process easier. Before going there, I'm just gonna share a Word document here I have. So I recently did a research project. So I was applying to the medicine subspecialty in Canada, and I was thinking like, what are the important factors that the medicine subspecialty, so people who apply to internal medicine and they're gonna apply to a fellowship, right? What factors the program directors look at? So this, I'm not saying that this is generalizable to the international medical graduates who are applying to the medicine or like surgery or like the CaRMS regular match, but I think we can draw some lessons from this paper. It's something like I thought about today in the morning. So I surveyed Canadian medicine subspecialty program directors, and I asked them, what do you look for when you rank internal medicine residents? So like if internal medicine residents apply to cardiology, gastroenterology, what are they looking for? And so the idea is we send them a questionnaire and we ask them to rank factors from 1 to 10, what they would consider important for inviting applicants and ranking applicants. Okay, so the important thing I want to share with you about the results. Okay, so the idea here, important factors for ranking applicants. So after they did the interview, now they have the CV, they have the letters of reference, they know you as a person through the interview. And I asked them, like, tell me what is the most important. Okay, so interaction with faculty during interviews or electives. So if you are doing any observership, your interaction with other people, it's really important, something that they look at. And interaction with resident during an interview or elective. So your interaction with other people during interview or elective, your interaction with resident during interview or elective, those are the two most important factors. But again, this results apply to Canadian subspecialty program directors. I'm not saying it is generalizable, but if the program directors of medicine subspecialty look at this, I do wonder, maybe the program directors of like the R1 match look at the same things. And from my sense, I don't have any numbers to prove this. From my sense, the interview is important. Like, why? So the idea here, I was like helping someone through their interview yesterday, and like, so we had a chat on why the interview is important. So when they apply, when they invite you to interview, let's put ourselves in the program shoes, right? So every year program, they get anywhere between 300 to 700 applications. And then they said, like this year, every program is different. I'm not generalizing. I can't talk about my program or any program, okay? So I'm just assuming how the process goes from my small experience through 4 years in internal medicine. So they say, like, we're going to invite applicants who have like Canadian experience. We're going to invite applicants who have observerships and applicants who scored more than X number. It depends. Some programs don't look at the score, some programs do. I know people who match even with low scores. So it might be a factor. We're going to invite applicants who have a strong letter of reference. So that's how they would look at the 500 applications. And from those 500 applications, they have a criteria. They choose 100. So the 100 application they chose, they are very similar. They have Canadian experience. They have good scores. They have good letters of reference. They have some research, or maybe not. They might have some volunteering, but they met a certain checklist that the program wants to see in their candidates. And most of the time, this checklist is derived from the CaRMS roles. And that's what I talk about in my course. In the interview course, I explained to you what is the CaRMS roles. And literally when 5 years ago, when I was like applying, I read about the CaRMS role. I did not understand them until I practiced medicine in Canada. And I believe it's a very, very, very important framework about the skills that the physician should have when they are practicing medicine, because I find myself growing any skill of in any given day, growing one of those skills of the CaRMS roles. And they are right, during any day of interaction with other people in the medical field in Canada, you're going to do some leadership role. You're going to advocate for your patient. You're going to communicate, whether it's written, whether it's oral. So they are very important. And most of the program directors, when they look at their applicant, they look at applicants who met the CaRMS roles. They have leadership, they have research, they have some skill that can apply to the CaRMS roles. And that's why the interview is important. So what is the purpose of the interview? Okay, so the purpose of the interview, it will help you to put yourself higher when it comes to the 100 applicants who are invited to the interview, because like those 100 applicants have everything similar. So the purpose of the interview, let's see from those 100 applicants, who are the 10 that we can take to our program based on interpersonal communication skills? How do you talk with other people? How do you interact with other people? So this is very important. How committed you are to the specialty, like if you're applying to internal medicine, are you like or like if you're applying to surgery, let's say, are you like hardcore surgeon, or are you like your CV says like you are doing bit surgery, bit internal medicine? How committed you are. And if you look at one of my interviews on a YouTube channel, I remember it was Dr. Youssef, a great surgeon, match in Toronto after 5 attempts or 4 attempts, I believe. So he, every year when he did not match, he went and talked to program directors. So he went and talked to, I think it was the family medicine program director, and he said like, hey, like why I didn't match? I have all this, a great experience in Canada, great scores, like what else do you want me to do to match? And he said like, you have to convince me that you are born to do family medicine. So they don't want only an applicant, they want an applicant who's committed, okay? They can assess if they can work with you at 3 in the morning. And this is very important. Residency is not walk in the park. Guys, I survived the war. If you know my story, you can check it on my YouTube channel. I went through, I was in the Syrian civil war from 2010, 2016. I survived the war. That was very tough. Anyways, I'm not saying that to make you feel sorry. I think the best experience happened to me. So I went through that. That was really tough. I was in Aleppo, the most dangerous city in the world at that time. And despite that, I found residency is hard, but it is doable. So they want someone who enjoy working with at 3 in the morning, because like, it is not easy pathway, but it is doable. And I've seen many people. The most I admire is one of my colleagues. She's a mom. I think she's in her 30s or 40s, and her kids are adults, and she's doing internal medicine residency. Amazing person. And she's an IMG as well. So it is doable. If she can do it, I think I can do it. Everyone can do it. They are looking for red flags. So yesterday I was helping someone with their interview, and there were some red flags here and there. They put someone down. Never, ever, ever talk bad about your country, the system you came from, observerships you did. Never ever talk about someone when you talk about your conflict experience. So don't do that, please. This is a red flag. Understand your specialty. How did you choose it? So also one of the things I understand when we do mock interviews with applicants is, so how did you, like, what made you choose internal medicine? And they give you like some reason that I was like, well, like that does not relate to internal medicine. Like this is important for the person who's interviewing you to know how you chose your specialty. For example, if you're applying to neurology and someone in your family had Parkinson's disease, that experience might really affect your heart. If you're applying to internal medicine and you want to do oncology in the future because like you have a strong family history of cancer, so that story is strong. If you are applying to internal medicine and you love teaching and you showed that you love teaching through participating in various teaching experiences, so that is important. You like the mental thinking and you did some things in your life that shows that. For example, last year I was interviewing this person who told me they love internal medicine, and they asked them why. And I like their reason, because like their entire life, they enjoyed reading Agatha Christie and similar novels where they have to think and know who is the victim. And internal medicine is mainly lots of mental effort. We are in internal medicine, the thinkers. We think a lot. We take into account different diseases, how they interact with each other, right? So understand your specialty. This is important. Can you handle stress? Very important. If you can't handle stress, if you don't do something outside of medicine, it's like you can't handle residency. And I always like we're going to talk about questions like we're going to talk about tell me about yourself. And I always advise applicants, mention something about yourself. You never know how you can react with the person who is interviewing you. And for example, if you look at my background, so my background, I have my bike. When I interview people, they always, when I interview people, like I'm interviewing by myself, like I'm also applying for cancer fellowship, oncology fellowship in the US. So that bike made one of the people who is interviewing me, he asked me like, oh, like I see a bike in your background. Do you ride? I said, yeah, I ride. And he was also a biker. So we had like 5-minute conversation about biking and the trails in his program area. So small stuff, but also don't go over. This is important. A story I heard from my discussions with one of the program directors is they were interviewing this person and he has a bird that jumped into the screen. So that's a bit extra. It might be nice. It might be something that is spicy that will help the people who are interviewing you to remember you, but it might also be a red flag for some people. So it's difficult to interpret how different people will react to that. All right. So I would mention that too. Can you receive feedback? This is very important. Very important. People go to residency thinking that they should know how to practice medicine. No, you don't. You learn medicine in general in textbooks in medical school and through the MCQ questions that you do before you start your residency. That's the knowledge part. The practical part on how to practice medicine is different. You learn that in residency. So to be teachable, you have to be a person who receives feedback. If you do a mistake and I come and tell you, hey, you did a mistake and let's work on this to prevent this from happening in the future, and you receive that, that's amazing. So that's a trainable person. We love to take him to the program. But if you're a person who has a high ego or big ego, and you say like, no, I didn't do that, and you can't receive feedback, and you have blind spots, you can't see your mistakes, that's a red flag, okay? Can you accept your mistakes? We talked about that. What do you add to the program? Very important, because like programs grow through their residents. It's not the job of the program director. I would say the program director does a lot when it comes to growing the program. But the applicants who take initiative in creating a new curriculum, in creating a new lecture for half days. So these are important. So what do you bring to the program? They will even ask you. 2 days ago, I was like interviewing for one of the programs and they asked me, why should we choose you? And then I told them about like my leadership skills and I gave them example and I told them how this will help me to grow in their program and how I can contribute to their program. So they ask about that. What do you add to the program? And finally, things to know before the interviews. I'm going to skip that just for the sake of time. And we're going to talk about the practice. So this year, all the interviews are virtual. That's my understanding. Sorry. General tips for virtual interviews. Okay, so one is very important. You have to have a nice slides. You have to have a nice background. Because like now, this is the second year or third year that people are doing interviews, virtual interviews, right? So the level is rising. Like you can get a nice slide from Amazon for $10 or $15 or $20. I don't know how much is it. Or if you have a nice light like here, so what I can do sometimes is I can change the angle of my screen and my computer. So I face the window and the light hits my face. So I will have the natural light for free during the interview. A nice camera also, like, I don't think it will hurt to get like a nice camera. It's like you can get a good camera for 50 or 70 bucks from Amazon. So have a nice background. Again, those are not rules. These are general ideas. They will not assess the technicality of your interaction with them. But the better you can present yourself, clearer picture, better voice, better background, nicer lights, the more chances that you will be likable. Because like the interview, there are many subtle things that will make someone like you or not like you, right? It's just like seeing a picture that is, if you see a cute person, that they are gorgeous, but the picture is blurry, you might not, I would say, you might not really appreciate all what they have to offer. So do your best and have a nice background, nice lighting, nice voice. So I'm not using a microphone. I don't use microphone during my interviews. I use microphone to record my lectures or my courses, but it's not wrong. So my laptop has a good microphone, so I'm not that worried about it. So the sound and the voices and lighting and the backgrounds are the three important things to think about when it comes to virtual interviews. Okay, and before going to the how to approach it, is another tip I want to talk about is rule number one: practice, 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 practice. Your non-spoken language plays an important role on how you communicate with other people, and to be able to be yourself, to show a good level of energy without anxiety in the interview. This comes with lots of practice, because when it comes to an interview, there is some degree of memorization and there is some degree of self-reflection before your interview. The interview questions are all over the place and they are known to everyone. I'm not bringing anything new, but you have to sit down and think what makes you unique, what makes you different, and how you will answer these questions. And this is not easy thing. Like, you have to have insight to yourself. What makes you strong when compared to other applicants? The next step would be, after thinking and writing down your answers, like, you have to memorize these experiences and how to talk about them, because the interview also have a big part of it. It's storytelling. I have to tell you a story to convince you about my strengths. If you ask me what are your strengths, I tell you I'm resilient, I'm a good leader, and I'm a good listener. And I shut up. Well, like, anyone can say that about themselves, right? But if I tell you I'm resilient because I survived a war, I'm a strong leader because I was able to bring many people together and conduct several research projects. I was able to bring many people together and create a YouTube channel for IMGs. I'm a good communicator because I always receive feedback through my all rotations, that I communicate well with my patients and I listen to their concerns. I communicate well with the medical students and the junior learners. So I gave you an example. So there is part of memorization there. So I have to learn the story, how I'm going to tell it, because it has to make sense. But also at your interview day, you will be a bit anxious, and this anxiety can affect your ability to retrieve this information. So when you practice a lot, you will overcome this performance anxiety. You practice with people who are in medicine applying with you. You practice with people who are outside of medicine. Yes, your partner, your friends. You sit down and you ask them to ask you a group of questions, and then you tell them stories and you ask them, does this story convince you? How did you, or what did you hear when I told you the story? Do you think that this is a good example of you want normal people outside of medicine to listen to your stories and make sure it makes sense, because you want to hear what other people are hearing from your story. Okay, it's not what you perceive, because you know the story, you live the story, but you want to make sure the other person also understands your story. So practice with people in medicine, practice in people outside of medicine, practice with your camera. Open your camera, open a meeting by yourself, talk to yourself and look at your body language. Are you convinced by what you are saying? Practice with the mirror. So that's very important. Okay. The next thing, after we talked about practice and the interview process, now let's say I got an interview, I have an interview and I will prepare. So I do a Google search, and the first thing I get hit with is 200 questions of interviews, 100 questions of interview, 300 questions of interviews. But that's a wrong way of approaching it. Like 300 questions. Do you want me to sit down and write answers for 300 questions? Is it having more questions beneficial? No, like simplifying things is the most important. Order and simplification, the first step toward the mastery of a subject. You have to make it simple. So that's why over the last 4 years, I would say 5, because like one of them was preparing for interviews. So Over the last 5 years, after preparing for interviews, being on both sides of the table, going through lots of interviews, helping people with their interviews, the questions can boil down into categories. And it's simple. First, questions about yourself. Tell me about your strengths, tell me about your weaknesses, tell me about yourself. Why should we choose you? What do you bring to the program? Why you are different? Why you are unique? What will your friends tell me about you? This is all your friends. Questions about your specialty. Why you want internal medicine? Why do you want neurology? What do you think internal medicine is, or what do you think, or what challenges are facing internal medicine in the future? So why did you choose this specialty? What inspired you to do this specialty? Why? So those are the questions about the specialty. So you have to understand what you are applying to. You have to understand where are you going. And finally, questions about your program. Why our program? They are asking that because, like, do you know where are you going? Do you know what kind of city you're going to live in? Do you know what kind of friendships do you have? I understand as an IMG, I was desperate 5 years ago when I applied to residency. I was like, I want to match anywhere. I want to match anywhere. Partially because, like, that's a fear, because, like, acceptance rate is low and it's competitive. I understand. But you have to understand the program that you're applying to. After, I'm so happy. I did my internal medicine residency in Ottawa. I gained so much friends. I like the stories and the friends I made. It's just like great. And when I compare my experience to other friends, so some programs are big, some programs are small. A small program, you might not enjoy the city. Big program, you might get lost in the program. So know the program that you're applying to and know what you enjoy in the program, and show them that. Questions about your previous experiences or hypothetical situations. So, so those are situation questions. Tell me about a conflict. Tell me about a time you made mistake. Why? Because they are assessing first, do you know how to approach difficult situations? Do you know how to get feedback? Do you admit your mistakes? Do you learn from mistakes? Do you change your behavior based on your mistakes? And this comes from the business world. Many people hate situational questions, but like literally in the business world, there's a lots of research. Your previous behavior predicts your future behavior. And that's why they ask you about the conflict. That's why they ask you about a mistake. That's why they ask you about difficult patient. That's why they ask you about professionalism. Because whatever you did in the past predicts what you're going to do in the future in their program. So those are the 4 sets of questions. Okay, questions about yourself. The most common question is, drums please, tell me about yourself. So some programs might start with, tell me about yourself. Some programs, they say, what brings you here today? Some program might ask you, what makes you unique? Some program might ask you, why should we choose you? Usually, if the question, so here, like, why should we choose you? You can argue that there might be asking about my strengths. So if this comes in the middle of the interview, why should we choose you? And in the middle of the interview, I already spoke about myself, so I can talk about my strengths. But if in the beginning of the interview, you open camera, hello, good morning, thank you for inviting me, and Dr. Odabashian, why should we choose you? So here, I will answer the same thing, tell me about yourself, and I will tell you why. What makes you unique? What brings you here today? So all these questions are, tell me about yourself. So what is it about this question? Okay, so when it comes to the question, tell me about yourself, it is the icebreaker between you and the person who is interviewing you. And the icebreaker is the most important. The first 1 minute, 30 seconds to 1 minute interview, during the interview is important. So either you grab their attention or you throw their attention away. So in this question, you're going to highlight the most important achievements in your life. For example, yesterday I was like interviewing someone, helping them in their US interview, and I asked her about yourself, and she starts telling me about her brothers and sisters and the family, and then she jumps about her travel history, and then she jumps about talk about like different things, right? So I was like, so how this is useful for me as a program director? So you have to understand the purpose of the question. So the structure of the, so you can structure, in my course, I talked about the structure. So you can talk about where did you do your medical school, achievements during your medical school, did you do residency or a fellowship, did you take any leadership roles, any achievements in a new country that you arrived before, like back in your home country, and then the country that you arrived to. Who are you as a person? And what are the things that always end this question about with talking about the things that you like? Let me give you a good example. So in my course, I talk about a weak answer, but like we're going to skip that. And we're going to talk about a good example. It's not strong, it's a good example. I've heard stronger than this. So, and again, please, I'm not using this examples to put words in your mouth. I'm giving you an example on how to structure a similar answer. So you have to structure similar answer from your own experiences. You have to be the person who's telling the story. Okay, so tell me about yourself. Thank you for the question. I want to tell about 3 experiences that made who I am today. This line is important. It gives the listener an expectations on what to hear. So you know that this applicant is going to tell me about experiences that shaped who is today, and there are usually 3. Why it's important to set expectation at the beginning of your answer. In a given interview, they interview anywhere between 8 to 16 applicants. Imagine you are the number 16 at 4 p.m. after spending a whole day interviewing people, and now we are going to interview you. Is the person interviewing you going to be like active, like good listener, or like they will be so tired, overwhelmed, they just want to go home and they want to go through this interview. So when you set expectations and you give them an easy way to understand what they're going to say, this will make their life easier. I was born and raised in a small town in south of Ottawa. I grew up in a small family, but with very tight connections. Okay, so this applicant is talking about their family. My siblings, grandfather, and parents lived under one roof. My grandfather, a farmer, most influenced me and touched me with his work ethics early in life. He kept working until he was 73, when he unfortunately developed Parkinson's disease. Just a disclaimer. So this is a neurology program, and the applicant is applying to neurology. So now he's talking about his grandfather, who that's how he linked his family to his Parkinson's and to Parkinson's disease. I witnessed how this disease affected him and my entire family, which motivated me to pursue a career in medicine, to follow my passion. So he's answering the question, why neurology, early. He's setting the grounds at saying that, you know something, my family history really affected who I am. I went to X medical school, and there I fell in love with neuroanatomy and brain pathology, which helped me understand how my grandfather was affected by his disease. I want to pursue more research and expand my knowledge in this rapidly growing field. So I joined Dr. X in his basic lab. I spent lots of time learning science research method. So now he's highlighting something that, you know, I'm not only a clinician, I'm also a researcher who do a hard type of research. Basic science, man, this is no joke. This is no joke. Research is tough. Basic science research is tougher. Successfully publishing them in X journal. So he's highlighting his achievement. I did not only do a basic research, I also published. So now we know that this guy achieved something in his life and why he wants to do neurology. Dr. Rees was a great mentor and a teacher. He taught me the importance of research. His work where ethics inspired me. I see myself pursuing a career in research. Inspired by his mentorship skills, I created a medical student neurology journal club and organized weekly meetings under the supervision of Dr. Y. So now he's telling me about how he's a leader. And this is part of the CaRMS roles. The guy took initiative and he created a neurology journal club and organized weekly meetings under the supervision of Dr. Y. So he took the initiative. He's a leader. He's a communicator. He's an advocate for other people's education. And he is again showing why he wants to do neurology. So let's see the experiences. His grandfather had Parkinson's disease, and here he did some basic neuro research, research in neuroanatomy, and then he created a medical student neurology journal club. Oh my God, like this guy really wants a neurology, man. You can't convince me something else. I did an exchange program at the University in the neurology department and worked in their stroke units. So he went to a foreign country and he did some exchange program and he was exposed to stroke. And he was exposed to stroke care in underdeveloped areas. wow, so this guy's application and tell me about yourself story is a screaming neurology. Beyond medicine, I love cooking, especially cooking cultural dishes. I find it a nice way of being able to distress. So he's telling me that he is a normal human being and do things outside of medicine. I love running and I have, so please don't get me wrong by the word normal. There are many people who only love medicine. I don't have anything against them. That's totally fine. But during your interview, show that you have something, even if it's something simple, reading a book, that might help. I love running and I have done 4 marathons so far. So this guy is committed. He can run marathons. And also looked at the, let's say this guy is applying to Ottawa. I looked at the Ottawa Marathon and I hope one day participate in that. So that's in a nutshell who I am as a person. So here in the last line, he tells me that he's a runner. Imagine that I'm the person who is interviewing this guy. I'm a runner as well. I did 3 marathons last year. So now we'll have conversation about marathons. Oh, tell me a bit about more of the marathons. So we go to, and when it comes to the ranking and talking about this applicant, I remember the guy who ran a marathon. That's what will stick in my mind when it comes to the ranking process, or the program director's mind when it comes to the ranking process. Yes, it's important to have research, but it's important to have like academic performance, but also like it's nice to have something outside of medicine, because like that's what will help people to remember you at the end of the day. And I hope one day I participate in that. So that's in a nutshell who I am. That's how you approach. Tell me about yourself. Any questions so far? At 8:45, we're going to stop. We're going to take more questions, but any questions so far before I go and talk about other categories? All righty. The next thing they would ask you is insight to the specialty. Very important. As I told you through many interviewing many people, why X specialty? They want, so do you see this guy? This guy was born to become a surgeon. So like you should convince them that you were born to become a surgeon. That's how like you should approach this. Like you have, that's how convincible you should be. So why this is specialty? That's how you, like you should tell them like everything in your application should scream. And we have a question. Does doing a residency in internal medicine in your home country help? Sure, if you're applying to internal medicine and you already do internal medicine, oh my God, that would be awesome. Because like you know how to practice medicine. So training you in the subspecialty or in the internal medicine program, it's going to be easy. I'm just answering one of the questions here, guys. But let's say you did internal medicine back in your home country and now you're applying to surgery. You should have a strong reason to tell me why you are switching. It's not possible. It's not impossible. It is doable. But you should have a good reason. Okay, so let's take an example. Why this person, so this is an example of a good answer on why do you want to do internal medicine. There are many reasons to apply to internal medicine residency, but I will highlight the most important 3 experiences. Again, he did not say, I love thinking, I love teamwork, I love patient advocacy and stop there. No. This guy is going to tell me about the experiences and he's drawing a picture with his word. I'm going to tell you 3 experiences. So let's start. My passion for internal medicine was triggered early in my clinical years when I was lucky to do my first rotation in internal medicine ward with Dr. ABC. Okay, that sounds good. I enjoy the complexity of patients and thinking about their medical issues. I loved how internists were very thorough in their history and physical exam. They taught about the big picture and how to treat different conditions considering interacting medications or other pathologies. Since childhood, I've been fascinated by crime novels and Sherlock Holmes stories, and internal medicine suits my personality. So he has an experience through his clinical years, and he has an experience through something like his personality matches or suits internal medicine. I found internal medicine highly mentally stimulating, special ability to treat many complex diseases. And so that's a good reason. Now, the second is my passion for teaching. Okay, my mantra in medicine is see one, do one, teach one. I believe that teaching is the best way of learning. Oh, so it's not only saying, it's my case, I'm orthopedics. Okay, so there's a comment. Yes, it is doable, my friend. It is doable. It's not undoable. If you have a good reason, to explain that, it's completely doable. I've seen people who matched to family medicine and they did radiology or anesthesia back in their country. So it is doable, but the idea is show you that you have to have a good example, good answer. And if you have a good answer, you are able to convince them, that's totally fine. So we are back. We are back from the chat to screen here. The second is a passion for teaching. My mantra in medicine, we talked about that. I participate in formal and non-formal teaching. So he didn't say only, I love teaching. This guy is giving me an example. He said like, hey, I don't only love teaching, I did teaching, okay? Your actions speak higher than your words. As an internist, I see myself teaching daily, especially since I want to pursue a career in academic medicine. Being an IM will allow me to do what I love and help me keep my education up to date. And this is very true. If you are in internal medicine, you know the best way of learning is teaching. And also, I joined my university undergrad IM interested group and got involved in IM curriculum development. Whoa. So he's not only into teaching, this guy also in making some curriculum and developing internal medicine curriculum for medical students. So in this example, he's telling me that he's a leader. He's a person who takes initiative. Finally, I enjoy being a team player. Since my high school years, I've played soccer. Okay, so that's a good reason of being a team player. The guy understands what does it mean to be. He didn't say, I'm a team player and stopped. He said like, no, I'm a team player, but let me give you an example. I played soccer. I'm a big believer of power of team. But then he links his previous experience in playing soccer and knowing that how he's a team player to internal medicine. Internal medicine will allow me to be a team player and advocate for my patients and help them through collaborating with medical subspecialties. For Canadian applicants, those words are important. As you know, collaborator is one of the important words in the CAN-MED, important parts of the CAN-MED framework. So he is not only telling me that he's a team player, he's telling me that he understands the CAN-MED roles. He is telling me that he understands what we are looking for. And the same applies for US applicants. Thank you so much for joining today. So you can use the similar words, collaborator, advocate, leader, because like practicing medicine is very similar between US and Canada. There are some differences when it comes to the payment system, when it comes to other things. But in general, you have, if you are taking care of patient with diabetes, you're going to talk to a dietitian, you're going to talk to a diabetic nurse educator, whether you were in the US or whether in Canada. Maybe in the US, you might consult endocrinologist. If you are in Canada, you might do it by yourself if you're an internist. That's the sense I'm getting from the scope of internal medicine, the difference between both two countries. It's just an example. I'm not saying anything good or bad about any country. So know your program. So the first thing is know yourself. The second thing is know your program. This is important. And finally, the first thing is tell me about yourself and know yourself, know your specialty. And the third group of questions is know your program, right? So they will ask you, in my course, I talk about when you search a program, what are the things that you want to look for? In the US, this applies. So in the US, there is a lot of variability, academic and community programs. In Canada, we are all academic programs. Are there any researchers, any famous teachers? Their website is the easiest way. So those are the things that you want to look for in the program. What kind of patients you will see. A program in a small town, you might expose to the bread and butter. A program in a city where they have like 1 million population, you're going to see the rarest of the rarest, man. It's going to be crazy pathology that you will see. But the question is, what do you want from the program? You want to become a good clinician? You want to become a good researcher? Those are very hard questions to answer before residency. Usually you learn this through residency. What is the match rate? Like, are they like, how many fellows match to whatever they want? Because like if a program is a heavy on service and their fellowship match rate sucks, like this could be a red flag for you. You don't want to be overworked, okay? Read about the city as I said earlier. So let's talk about, let's say I'm a program director, I'm asking this person, tell me, why do you want to apply to our program? So many reasons make me want to attend the program, but I will highlight the 3 most important reasons. Do your research program, especially in Canada. Why I'm mentioning this? In the US, there is a big variability between the programs. In Canada, there is a small variability between the programs because most of the programs are governed there. It's only, for example, internal medicine. I remember when I applied to 8 programs. So the people in the US will be shocked now because you applied to 180 programs or 150 programs. Yes, they are very small community and there are very set guidelines on what every program should do. And they are all monitored by the Royal College. So do your enough search. I love how your program offers early responsibility with direct supervision where residents can rotate in intensive care unit and emergency department during their first year. Okay, so this guy read about the program, knows that we let PGY1s do ICU and emergency department and rotate in the emergency department. And this was one of the variables between programs when I applied to internal medicine 5 years ago. Some programs, they will let you do ICU in your first year. Some programs will not let you do ICU. 5 years ago, I loved ICU. So it was important for me. This early exposure with the support from staff and trainees is something I'm looking for in my training in internal medicine. So this is 1. 2, since medical school, I've been interested in point of care ultrasound. And as I read and heard from residents from your program, so this guy or this applicant or this girl, they did not only read, they went and talked to residents and they asked about the point of care ultrasound. And this guy is, or this girl is like interested in the point of care ultrasound and they are interested and they know that we offer point of care ultrasound and they are bringing this up. You have great researchers in the program who publish in XYZ journal and I'm passionate about research. I would love to work with Dr. AB and Dr. DH during residency to improve my research skills and expand my knowledge. So the third thing, like he knows, like for example, in Ottawa, we have Dr. Wills. If you know Wills' criteria for pulmonary embolism, the person who did the research and created the rule is like in Ottawa. But this, it's a double sword statement. Because if your statement is general, like I know you have great researchers and I want to work with those researchers, I want to be part of your program, that's nice. But if you are dropping names that I know a person in your program, that's why I want to come to your program. It could be a bit wishy-washy because in a not direct way, you are telling me that you have acquaintances in the program. So be cautious on how you approach dropping names. And that's why I put the number 3 here. Some people respond to it positively. So because this might show what do you know about the program. If you are talking about big researcher, that it is very well known that, for example, Dr. X, who published in New England Journal of Medicine, works in this program. That's usually a good thing to say. But saying that, oh, my friend who's doing residency in that program told me that this is a great program. So some people respond to it, okay, so he has an insight about our program. Some people might have a negative effect that, oh, this guy is dropping names, that he knows someone in the program. So it's a double sword. Be general, don't be specific. That is the safer way to approach it. Finally, I love ABX city. I have visited the area several times with family members and friends. Continuing my residency in a place where I have a strong family and friend support. So it's not only about the program, guys. It's not only about the program. Search the city. If you are going to a multicultural city, for example, I was interviewing for Detroit. Great program and multicultural city. I love living in a multicultural city. So I would bring that up, that I'm a person with multiple backgrounds, or I'm in different places. So I would love to live in a city where it offers multiple, where there are multiple cultures and restaurants and stuff like that. And I would love to thrive in your program. So give them reasons, give them examples, show them that you know their program, and show them that you know the city. If you have a support system in that city, go for it. Talk about it. Alrighty, last category, and then we will take questions. Tell me about a time. So usually those are behavioral questions. They will ask you, tell me about a conflict. Tell me about a time you made a mistake. Tell me about a time. This is more common in Canada, but I heard people being asked these questions in the US. So prepare for it. It will never hurt. So tell me about the time. That's how people feel. Tell me about the time. Oh, crap. It's hard to approach these questions. That's how people feel. But It's not the situation. So here you have to develop a skill. When I ask you to tell me about the time, you have to know how to tell a story. Let me tell you the story of the Beauty and the Beast. Yes, I'm going to tell you the story of the Beauty and the Beast. Most of you know the story of the Beauty and the Beast. If I tell you the story like the Beauty goes to bed at 9 p.m., the Beast wake up at 4 a.m. The Beauty lives with her father. The Beast had chicken for lunch, and they lived happily ever after. Like, what are you talking about? Why you are telling me the Beauty goes to bed at 9, and why are you telling me the Beast had a chicken for lunch? How am I going to link this? It doesn't make sense. And then you are telling me they lived together happily ever after. Like, wow, what kind of story is this? But if I tell you the story of the Beauty and the Beast with the important things about the Beauty and important things about the Beast, and I tell you how they met and how they lived together and how the Beauty ended up loving the Beast, that will make sense. That will make you feel happy. That will make you engaged. And I'm sure 100% all of you now having some flashbacks from cartoons about the Beauty and the Beast. So you have to learn how to tell a story. And there is a structure. It's not chemics. Okay. So I find this is people like don't know a lot about it, but this is how to tell a story. So start the interview technique. So first you tell me about the situation. I was doing my rotation in X hospital with X doctor. I was seeing X amount of patients a day. Task. I was the leader of a CTU internal medicine team, and I was supervising 5 junior learners and 3 medical students. Action. I disagreed with my staff on managing one of the patients, or my staff asked me to do X, Y, and Z to these patients, but I felt uncomfortable doing this. So I went and I talked to my staff, and then I went to talk to the patient, and we were able to find a common ground, something that satisfies us all. Result, I learned how to solve conflict. I learned that communication is very important in conflict. So in conflict resolution. That's a very simple way of talking about the STAR technique. There are tremendous amount of examples out there. Use the STAR technique to tell a story. It's not something difficult. Okay, so when it comes to the STAR technique as well, when I tell you, so the same story might show several things. So if I told you a story about me having conflict with my staff, and I was able to resolve that conflict because I was worried that my staff decisions might affect patients' care. What are the things I can extract from this story? First, I know how to resolve conflict, so I can use this story for conflict. But at the same time, there is some sense of professionalism here, because knowing how to talk with your staff and your attending in a good way that don't hurt their feelings and find a common way to approach them shows professionalism. So the same story can be applied for professionalism. Hey, wait, but you were worried about your patient. You advocated for your patient. So the same story can apply for advocacy. So same story can have multiple, one story can highlight different skills that you have. And that's why when you structure your stories, you need 3 to 5 stories to answer most of the questions. What will change is how you talk about the action and how you talk about the result. So if I use the same previous that I disagreed with my staff to advocate for my patients, I would talk about the same situation, the same task, but my action is I will emphasize that I went and I talked to the social worker, I talked to the patient, I advocated for the patient, and the result is through that story, I learned how to, the importance of advocating for a patient, the importance of talking on behalf of people who have difficulties or issues. So that's what will change, how you end your story. So the same story can highlight multiple skills or different skills. The idea is how you talk about it and how you end it. And that's what will help you in answering the person's question. I have an example of conflict in my course and example of mistakes, but it's 8:57. We have 3 minutes. I'm happy to take questions because I have to go by 9. So hit me, guys. Any questions? You can open the mic and talk to me, or you can type. Of course. So there is a question. Is it okay to add some leadership details that are not reflected in your CV? Actually, it is your job to highlight your leadership. If you don't highlight your own leadership skills that are not highlighted in your CV, they are gone, man. They are gone. So it is your job to highlight the things that are not. That's the purpose of the interview, to know you outside of your CV. Yes. So any tips on what to ask? Again, it is in my course. I have like, so your questions again will be in categories. Let me just show you this slide. Do you have any questions for us? Okay, so let me share this slide. Okay. So when you ask the program, sorry guys, just a second. Share screen, portion of screen, share. Okay, can you see my screen now? The categories. So we're going to ask them about how they evaluate their residents. You're going to ask them on how they mentor their resident. Mentorship is very important. As an IMG, I did not know how important mentorship is until I did residency. You have lots of blind spots. You need someone to guide you through your career, especially if you're going to do research or academia. Teaching, what opportunities are available, the patient demographics, what kind of pathologies you see. For example, in Toronto, you're going to see the rarest of the rarest. In Kingston, you will see mostly bread and butter. You might see the rare things, but city-wise, number-wise, the pathology will be a bit different. Okay, research. Is there a form of research training? The research do patient, or how much protected time residents have to do research? So there are many aspects. Again, don't be overwhelmed. Think what is important to you from this category in your training and create questions around those categories. If you search online, you're going to find hundreds of questions to ask programs. But remember that everyone else have access to these questions, and people get bored of getting the same questions again and again. So when you ask questions that are relative to you and justify why you are asking that. So for example, 2 days ago, I was doing an interview and I asked them what type of electronic medical record they use, but I did not only ask them that. I said, like, I'm very interested in research, and the electronic medical records can give you a strong, like, they can give you an edge to do research because they can give you access to patients' data. So can you tell me what electronic medical records do you use? So one, I'm showing the program that, hey, I'm interested in research, and that's why I was asking about the electronic medical record. And we had this prolonged conversation with the staff, and he was telling about 2 electronic medical records and 2 hospital systems. So he explained to me the VA system in the US and how you can have access to a a huge amount of patients' data. So it's a question that it was important for me. I didn't search online and find a question. You can do that to brainstorm, but ask yourself, what is important to you? And ask unique questions to yourself to show real interest, genuine interest in the program. All righty. Tell me about yourself. So usually you have 30 minutes in an interview. They will ask you around 5 to 6 questions. So each answer will take anywhere between 3 minutes to 5 minutes, taking into account that you will ask them questions as well. So 3 minutes to 5 minutes. And that's what I do with the people who I do mock interviews. So I'm very OCD when it comes to this interview process. I use an application to record the interview, and in real time, it gives me transcripts. So I can show you, like, in real time how long each answers take. All right, you guys, it's 9:02. I'm sorry, I have to. Do you have courses on person? I have, yes, I have course on CV. It's in the email I sent yesterday. I can share the links. here, so I share a newsletter. I have a CV course. I have a personal statement, sorry, interview course. The personal statement, hopefully I will try to create it because I'm still learning the base, or I would say I'm trying to create a way to help other applicants to carve their own personal statement. I want to create set of rules like I did for the interview process. Thank you so much, guys. Everyone knows my email. My email is all over the place. And recently I've been working with professional writers to help me also with reviewing CVs and personal statement. So you can reach us at support@CanMD Medical Consulting, consulting.ca, CanMD Medical Consulting.ca. If you have any issues, and everyone knows that my phone is open 24/7. I get messages from people I never met in my life, and they ask me questions and I answer them. Good luck for everyone. Nice meeting you. And sorry, I think I did not share my email. CanMD Medical Consulting.ca. Okay. Have a good rest of the day. Thank you so much for joining. I appreciate it. We had 45 applicants. That makes my day. Thank you so much.